This audio is about the examination of the coroner's report of JJKD from August 7, 2017. JJKD died of drowning on the 31st of December 2015 while under the care of a mental health service. JJKD has had a long battle with mental health issue and was diagnosed with a schizoaffective disorder and was in and out of the hospital. JJKD was first under the care of a mental health system in 2008 in Queensland. In April 2009, he was diagnosed with schizoaffective disorder and was commenced on quetiapine and lithium, which are antipsychotic medication. JJKD did not comply with medication and was placed on involuntary treatment order because of this. JJKD's care was well handled by the continuing care team in his community from May 2009 up to August 2013. In my opinion, the problem started when JJKD was commenced on a clozapine therapy by the psychiatrist Dr. IP from the community mental health clinic. JJKD did not respond well on lithium and olanzapine, so he was commenced on clozapine. Clozapine is a very strong antipsychotic medication, and it requires close supervision, frequent blood monitoring, and strict compliance should be observed. Nurse GK was assigned as his CCT case manager until the time of his death. Nurse GK was supposed to be transporting JJKD to the clozapine clinic on a weekly basis, but it was reported JJKD went there on his own a few times. From March 2015 up to July 2015, his clozapine levels were found to be consistently subtherapeutic that ranges 90 to 150 micrograms per liter, which was because of his non-compliance and alcohol and drug abuse. 250 to 550 microgram per liter is the lowest effective clozapine level, while 600 to 2000 microgram per liter is the recommended higher limit to avoid clozapine toxicity. JJKD already had a history of non-compliance to medication and drug abuse, and as a mental health nurse, it should have already been considered as a warning sign and should have been reported to the psychiatrist for review. On September 29, 2015, JJKD cut his wrist with a retractable knife. Further assessment also showed that he was going through depression without psychotic episode and becoming more paranoid and worsening abuse of drugs and alcohol. On September 30 and October 6, 2015, JJKD's mother continually raised concerns about JJKD's mood and declining mental state and reporting it to the CCT case manager. On October 7th, it was discovered that there was not enough documentation of JJKD's care. November 25, 2015, during an appointment, JJKD was noted very energetic and verbalized having clarity of thought. A week after the appointment, JJKD was arrested and charged, reported not sleeping and not taking his medication. December 23rd, he exhibited delusions and poor judgment and insight. It was reported that he had increased his use of drugs as well. The behaviors JJKD exhibited and the concerns JJKD's mother raised should have been taken seriously and should have been properly intervened right away. Nobody has been monitoring JJKD on medication administration and compliance, thus resulting for him to display more behaviors, deteriorating mental state, and possibly a relapse from non-compliance to clozapine. I believe JJKD's death would have been prevented if appropriate actions were taken and if the CCT case manager was more proactive. As it was found out as well that there was no proper documentation between the treating parties involved in JJKD's care, which consist of the psychiatrist, general practitioner, care manager, and the pharmacist. This compromised JJKD's care as well, as there was no records, no proper clinical documentation, and therefore no effective communication has taken place. From the very first warning signs, past history, and his mother's report, JJKD should have been admitted to an inpatient mental facility, and his behaviors would have been managed. Therapeutic intervention should have been taken to avoid the adverse effect of clozapine therapy. Avoiding these effects would have led to him being treated properly. Also, as a mental health nurse, we should be proactive and knowledgeable about this medication, the indication of use, and its side effects. A nurse should be able to support and inform a client taking this medication by providing psychoeducation, and also making sure that proper and consistent documentation is always done for clinical records and evidence.